Lagos. Good evening to you. Welcome. This is Practical Health Tips with Dr. Dr. Avon. You know that when it's Wednesday, we talk about health. Apart from the one that Kofi does on Thursdays. Here, brought to you exclusively by Avon HMO, we talk about practical health tips. Last week, we looked at the stigma surrounding STDs. Okay, STD testing. That was an interesting one. Today, we are looking at, and this is for all of you who are engaged to be married right now. While you're excited, while your head is in cloud 9, let's talk about the premarital health checklist. What you should know, what you should do as you prepare to say I do. This is brought to you by Avon HMO. You can find Avon HMO everywhere on social media at Avon HMO on X, formerly Twitter, on Instagram, and on Facebook. You can also send an email to them if you have questions, you have inquiries to make. Send an email to practicaltips@avonhealthcare.com. Practical tips at avonhealthcare.com. Our doc today is Dr. Oluwaseun Odunaiya. He is here to talk to us about practical health checklists. What you should do, tests you should run before you say I do. Hi, Doc. Good evening to you.
Good evening.
Doc, you have to speak into the... Hold your microphone. Hold it. Bring it. Hold it like this.
All right.
Let's get into the conversation. Good evening to you.
Good evening.
Well, Doc, why is having a premarital health checklist important?
Okay, so it's important for you and whether you're getting married to go through certain investigations, as they'll help you identify potential health risks that could become problematic later in life. I mean, it's not just about the honeymoon phase, the first 2, 3, 5 years. Down the line, long down the line, you have children. There are certain things that you need to have identified from the very beginning. So when they come up, it's easy to manage, and then it's also something you've anticipated before then. It would also, I mean, to a certain extent, help you decide, oh, I love this person, but do I want to go through all of this with this person? So that's why it's very key that you have those investigations done before you say, oh yes, let's go ahead.
What are some of those key problems that this premarital health checklist can help couples prevent?
Okay, so well, we'll look at the most common one, which is the sickle cell disease. Now, coming from the hospital, we've had instances where children present with certain illnesses or certain symptoms, and then we're asking the parents, oh, what's the genotype of the child? And they're like, we don't know. What's your own genotype? I don't know. What's your husband's genotype? I don't know. That is non-excusable. That is one. Another thing you can also look at is viral infections, sexually transmitted infections. This is something that you can unknowingly also pass to your children. I mean, literally, these children have done nothing wrong, but right from birth, they're already -1. So that's also another thing. That's also another thing to look out for. There's also the blood group and resource incompatibility.
Oh, it's my goodness. Let's talk about that one, Doc. That particular one is the resource incompatibility.
Yeah. So it's not just enough for you to know your blood group. It's also important that you know your resource factor, if you're positive or negative. The most commonest one is resource factor D. There are quite a number of other ones, but the most common and the most important one is resource factor D. So as a woman, wherever you're getting married to, it's important that you know the person's resource factor. For example, if as a woman your resource negative and the person you're getting married to is resource positive, you stand a chance of having something we call resource incompatibility. Now, it doesn't affect you. The problem is it affects your child. Now, for the very first pregnancy, it may not really be an issue. But what happens is your body gets sensitized to that foreign element, so it creates antibodies against it. So the minute you get pregnant the second time, your body literally would attack it. It sees it as a foreign agent, so it would attack it.
So maybe that's why a lot of women suffer multiple miscarriages and not know. I wonder why they have these miscarriages.
Definitely, it's a possibility. Wow. It's a possibility. I mean, also another thing is depending on the severity or the level of sensitization your body has gotten, it could be immediate in utero or maybe at the point of birth. So you have children coming down with very severe jaundice and then you don't know why. That's because your antibodies have attacked the blood system of that child. So it's broken down beyond what the child can clear, and then you come down with jaundice. Which, complications is the child can even have very severe and permanent brain damage.
Oh my goodness.
Yeah, so this, looking at all of this is very important that as little as these investigations are, you need to know, you need to have those results. It's not just enough to say, oh, I love this person, this person is the love of my life, I can't do without this person. These are important things that you also need to cross and dot your I's on.
Yes. So when people go to check their blood group or blood type, they often are presented with results that have either a plus sign or a negative sign. What do those signs mean?
So when you see a plus sign, it means your rhesus positive.
Oh.
When you see a negative sign, it means your rhesus negative.
Okay, so Lagos, that sign that you see at the top that is attached to either your A or
your
O.
A, your B, your AB or your O.
Yeah, that sign, whether it is plus or minus or negative, tells you that you're either your rhesus factor is positive or negative. So that way you know. So for women who have a negative rhesus factor, and I just want to ask, do men also have rhesus negative factors as well?
Yes, it's possible.
So if both of them, if two people with RH negative wed and have kids, what happens?
So in terms of rhesus incompatibility, you guys, that's not going to come up because he doesn't have the antigen, so there's nothing sensitizing your system against that antigen. So in terms of rhesus compatibility, you guys are fine.
Okay. So it works. It also works similarly in math, where minus gives plus, but plus minus gives minus. Look at that. I feel like a genius.
So I think I should also mention that for women who are rhesus negative and then you get married to someone who is rhesus positive, one of the reasons why it's important to know is because there is an injection you're supposed to get. It's called ROGAM, anti-D immunoglobulin. It more or less attacks those antibodies that your body has created to the rhesus factor. So it saves your subsequent pregnancies, any mishap or anything like that.
Let's talk about what couples should do after discovering some disturbing facts about their health before getting married. What should they do? Because some people say breaking up is not it's not a discussion. But what should they do, Doc?
Okay, so for you go through your test, you get your results. The first thing to do is to seek a specialist. Let them give you a breakdown on what these investigations are, the complications that can arise, if there are any treatment modalities, if there are any preventive modalities, anything at all. So you need to have that done. Have that by the side. Secondly, you now both need to sit down and reevaluate. With all of this information that we have, is this something we can manage on the long run? It may be easy. Oh yes, the love is blinding in the first 6 months, so we can do it. It's us against the world. But 3, 4, 5 years down the line, you may even be lucky. 10 years down the line, nothing happens, and then your child falls sick one day.
Just like that.
Just like that.
Wow.
And then all your problems begin.
And the thing with Nigerians is when that just happens suddenly, the first point of call is the blood of Jesus.
Yeah.
The blood of Jesus
heals all.
It's the blood of Jesus. And then they go to the hospital, they're given the diagnosis, they come back and apply more blood of the Lord. But this is something that could have been avoided from the outset. Yes. Okay. Now let's talk about the cultural or social stigma surrounding premarital health testing in Nigeria, because as much as this is important, a lot of people may find it challenging because they don't want to discover. They say if something ain't broke, don't fix it. So they don't want to discover something. They just want to keep. Nigerians hate going to the hospital. They just, once you tell them go to the hospital, they assume that they are dying. Why do you want me to go to the hospital? But let's talk about that, Doc.
Okay, so in terms of social stigma, I really don't think that should be an issue in the sense that, one, you're not getting married to the society. You're getting married to one person who you're going to spend the rest of your life with. So there are certain decisions, there are certain informations you need to have beforehand, irrespective of whatever the society is going to think or whatever family is going to think. It's important. I'll give an example, and it was something I saw during my early training days. So I started my training in the pediatrics unit, and we managed a lot of sickle cell cases. And there was this one, I remember it every time because of how it went. It was a 7-year-old child who sickle cell in his crisis was on the ward. And I mean, we're giving everything, the pain wasn't subsiding. And at some point, the child turned to the mom and asked, why am I going through this much pain? You could see the look of disappointment on both of their faces. I mean, the innocent child doesn't even understand why. The society is there. The society is doing what the society is doing, but you are the one dealing with the consequences of that action.
Right.
So, I mean, in terms of social stigma, I don't think that should really weigh on anything. You're doing this for yourself. It's good to know. Yeah, some people will say, oh, what you don't know won't kill you. But trust me, what you don't know can kill you.
Doc, let's talk about, not just premarital health testing now, but marital health checkups. Because, Doc, there are a lot of people who are married to promiscuous people and don't even know it. Before we came on here, I mentioned the case of a woman who got married to this man, and 7 years down the line, 7 years into this marriage, she fell gravely ill. Went to the hospital and was told she had AIDS, full-blown AIDS. Alas, this man had given her this disease while they were married. So what would you say to, married couples?
Okay, so it doesn't just stop at having these investigations done before you're married. You also need to have regular checks even while you're married. And I mean, checking for things like hepatitis B, hepatitis C, HIV, it is very important, irrespective of whether your partner is promiscuous or not. I mean, you could get it from a shared clipper at the barbing salon. You could get it from a used needle where you're making your hair. So you may not necessarily get it from your partner because he or she was promiscuous. You could have gotten it because he or she was careless. So it's important that regularly you check these things. And I mean, luckily for hepatitis B, once you check you're negative, you can even get vaccinated. And that vaccine largely prevents you from getting that infection. So it's not just for you to be oblivious and then go about your day without knowing. And I think that's why it was easy for this case to progress to AIDS. I mean, she probably didn't know, so there was really no need for her to be careful about anything until it was full-blown. So it is important that you have those regular checks even while you're married. It could be 3 monthly, it could be 6 monthly, it could be yearly. It's important that you do those tests.
Right. Let's talk about the role that preventive healthcare plays in ensuring long-term marital happiness.
Okay, so in terms of the preventive role, it literally starts from these investigations that we're talking about. Once you've had the investigations done, you have all your information. The next step is to decide, like I said, do we want to go ahead with this? Oh, you're AS, I'm AS. The likelihood that we will get a child that is SS is there. Do we want to go ahead? Rhesus positive, rhesus negative. The fact that you know that means, oh, doctor, please, my husband is rhesus positive, so I need to get the Rogam injection. It helps you. It preempts you.
Yeah, do you get the Rogam injection after your first baby and then before you get pregnant or while in active pregnancy?
Usually it depends. There are two different schools of thought. There's one who says you should have it at 3 different intervals, twice before you give birth and one after giving birth. But largely here in Nigeria, we give just before you give birth and immediately after giving birth. So what it does is it protects future pregnancies. from ever developing any complication from resource incompatibility.
Doc, thank you. We are completely out of time, Lagos. This has been a thoroughly interesting conversation brought to you by Avon HMO. Practical Health Tips with Dr. Avon, brought to you by Avon HMO. I hope that Dr. Oluwaseun Odunaiya has been able to convince you to do premarital health checks, and not just before getting married, but also while married. He said you can do it quarterly or you can do it twice in a year, but ensure that you get medical checkups even while married, beg your pardon, Lagos. If you'd like to engage with Avon HMO, then reach out to them on X, formerly Twitter, on Instagram, and on Facebook as Avon HMO. Or if you have inquiries, send them an email. The email address is practicaltips@avonhealthcare.com. practicaltips@avonhealthcare.com. Thank you so much, Lagos. Thank you again, Dr.
Thank you very much.
Lagos, this show returns to, next week, on Wednesday next week, when we'll discuss something even more interesting. But until then, bye for now.